the warning signs of a heart attack. Welcome to Dayspring Life and Health channel. This is Dr. Otin coming to you today with another very important topic on our series of cardiovascular diseases. Today we want to talk about the warning signs of a heart attack. What are the warning signs of a heart attack? Knowing what is going on right here from what we have learned so far, as you can tell, if the blood supply to the muscles of the heart is blocked, then the muscles of the heart begin to die. So a classic warning sign is chest pain around the middle of your chest, the center of your chest, because the heart muscles begin to die. Most likely you'll feel chest pain. That being said, not everybody feels that chest pain, but it is very common that if you are going to have a heart attack, you will begin to see your chest hurting and also discomfort, pain or discomfort. You can also see some tightness of your chest. Some people describe it as a pressure, like an elephant is sitting on your chest. So a tightness of your chest because of the heart muscles dying or not getting enough oxygen supply. And also, you can also feel a squeezing sense of pain. You could feel like somebody is actually squeezing your heart. So those are all signs of a heart attack coming. Squeezing of your heart. If you feel the chest pain, if you feel squeezing of your heart, or discomfort and tightness of the chest, those are classic examples of warning signs of a heart attack. Now, that begins to radiate to your arms. For some people, it will spread to the arms and the shoulders and also to the neck. So you will see that your chest started to ache, and all of a sudden it's going to your arms, it's going to your neck, it's going to your shoulders. Those are all signs of a heart attack looming. This lasting only for a few minutes, but then it may return. So you could get this over a period of days. In fact, in some people it will be a month before the real full-blown heart attack occurs. So you may feel the chest pain and the discomfort and the tightness, and in a few minutes it will be gone. It may repeat sometime sooner. What happens also sometimes is you may only feel that happening when you are exerting yourself, like you are exercising or you are climbing a flight of stairs, and you can feel that at that point where you exert yourself, where you're trying to do some strenuous activity, that is when you feel the pain. That is a classic sign that you are having a heart attack around the corner. You may also feel pain in the abdomen, in your stomach. Some people feel that their stomach is hurting, pain in the abdomen. That is also a sign. So this can appear at the same time or right after the chest pain starts, or it may just be by itself. And when the chest pain happens, and as you can tell, as no oxygen is supplied to your heart, you may also, because the heart is not getting the strength it needs to pump blood and to receive oxygenated blood, you begin to feel short of breath. You begin to feel that you are gasping, you need air, but you can't catch your breath because you are short of breath. That is another sign that your heart muscles are dying and they cannot pump oxygenated blood to your body, and you are feeling that you are short of breath. So that is another progression that shows that a heart attack is on the way. And you may also have cold sweats, and also you may also have nausea. Some people even would vomit, and also you may also have lightheadedness. You may feel dizzy, unusual dizziness that just happened after your chest pain, most likely happening after your chest pain. But I got to tell you that in some women, they may not even have the chest pain. They will just have the lightheadedness, the neck pain, or the arm pain, and that will be all they know about their heart attack. So that is a slight difference between men and women. But they may get the lightheadedness, they may get the shoulder pain, the stomach pain, they may get any one of the other signs. So it doesn't always have to be just chest pain. You can also have back pain. As a matter of fact, you can have, so it's not just neck pain. You could have jaw pain, back pain, and also lightheadedness. All those are signs of a heart attack looming. And again, this may take, depending on the individual, depending on how bad their situation is, it may take a few days, it may take a few minutes before the real heart attack happens, or it may just be right before the heart attack. You may have these mild feelings for some time. You got to make sure that you do something about it, because you are lucky you got a warning signs. Unfortunately, most chest pains are associated with acid reflux. So people confuse, acid reflux or GERD with heart attack. That being said, you got to know your body. If you don't usually have acid reflux and all of a sudden you have chest pain, you don't blame it on acid reflux. You got to ensure that it is taken care of. I mean, you bring it to the attention of your doctors as soon as possible. So with these signs being said, what do you do then when you see the signs of a heart attack coming? So the first thing to do is to call for emergency assistance. If you're in the United States, you call 911 right away. If you're in other places, you call the emergency help system so that you can immediately be carried to a facility where they can stop the heart attack, or see you and treat you and prevent more damage from being done to your heart. So that is the first steps, to call for help. Call for help. If you can call yourself, shout and tell somebody to call 911 for you. Call the emergency, call the ER for you. Call somebody for you. Call yourself if you can, and tell them you think you're having a heart attack. If you say that, if you're able to say that, they will rush there. All right, so that's the first step. The second thing is, if you have had a heart attack before, or if your doctor has seen that you are at a serious risk of having a heart attack, they may have given you a medication called nitroglycerin. Nitroglycerin. If you have that medication prescribed by your heart doctor or your doctor, you can definitely take some as soon as you feel any of these signs coming on. But again, you don't just take them and stay. You take them while you call your emergency response for help. So if you are on medication for heart attack, nitroglycerin to prevent chest pains, the doctor tells you that when you see chest pain coming on, pop one. If in 5 minutes it's still there, pop another one. If in another 5 minutes still there, pop another one, and then call the ER or rush the ER or whatever they tell you. However they tell you, make sure that you take nitroglycerin if you have that prescribed to you as directed. Now, the other people that may have this symptom the first time and for whom no prescription for nitroglycerin has been given, what you want to do then is to immediately again call for help. Call the emergency room. Call 911. Call the emergency response team or whoever it is in your area that has the capability of carrying you straight into the hospital. If you are in a place where there are no ambulances to bring you, let somebody give you a ride. Don't drive yourself, because you may have a more serious attack on the way. So get the help, get somebody to drive you if there's no ambulances to carry you to the ER or to the emergency room, and make sure you get there ASAP. It's the difference between life and death. The earlier you get to the hospital, the more likely you are going to be saved. So if you are not on a medication for anything like that, like the nitroglycerin, your first thing is to call for help. Get somebody to get you to the emergency room as soon as possible. The second thing is, while waiting for help, if you have aspirin is a blood thinner, and if we can go back to where we see the plaque and clot formation here, if you are somebody that is on a blood thinner, most likely this clot formation may be delayed. Even if the plaque is broken off and the thrombosis or clotting thing begins, your clot formation will decrease. So The idea is, if you are waiting, when you are waiting for the emergency people to come, take an aspirin. If you have 80 milligrams of aspirin, I would encourage you to take maybe 4 of them to make at least 320 milligrams or more. Take 325 milligrams of aspirin if that's what you have. If 80 is all you have, take about 4. And however much aspirin you have, because at this point it is the only thing you can do to prevent the clot from being worse. For the more the clot forms, the more the pipe here is going to be blocked, and if it's blocked, your heart is going to continue to die because it's not getting blood. So get some aspirin as soon as possible if you see these signs. Now the caveat is that if you are not sure that the signs you are having is a heart attack, is leading to a heart attack, then taking aspirin may not be the best idea, because aspirin has its own side effects. Until recently though, aspirin had been recommended for people at higher risk of heart attack and strokes, so that it will prevent it will prevent clotting from happening just like that. So with that being said, aspirin side effects could be, it could increase bleeding in people, especially who are elderly, people 60s and up, 60 years and older, 65 and older. Aspirin may increase your chances of rectal or GI bleeds, your gastrointestinal bleeds can be worsened by aspirin. But I'm thinking that if you know for a fact that what you're experiencing is a heart attack, that is going to kill you right there and then. So and at that moment, if you know these signs are showing up, then I wouldn't think about bleeding at that point. I would take the aspirin and ensure that you don't die of a heart attack. At least when you get to the hospital, they can stop anything that is related to bleeding. Of course, it has to be taken also in conjunction or with the knowledge of what you're already taking as medications. Let's take care of ourselves, let's take care of our hearts, let's prevent the high blood pressure from breaking out the plaques. The higher your pressure, the higher your blood pressure, the more likely the plaques are going to break off and start the clot formation. Also, the worse your diet, the higher fatty meals you eat, the more chances you are going to increase the formation of this plaque lining here that will eventually block the blood flow. So diet will help, and of course reducing your blood pressure and doing exercise, all the good stuff will help. Thanks for watching, beloved. I wish above all things that you prosper and be in health, even as your soul prospers.